Today's the name of the article is the Physiological and the Biochemical Changes with the Vamana Procedure. This article written by the Bharti Gupta, Sushil C. Mahapatra and the Ramesh Babu Devala. What is the abstract of this article? The Vamana Karma, that is a therapeutic emesis, primarily a Sankshodhana Karma, that is a purification procedure, is one of the five Pradhana Karma, chief procedure of a Panchakarma. It is a mention in Ayurvedic text that a person after a Samyaka Vamana, that is a proper Vamana, experiences a lightness of the body, Rudya, that is a precordium, Kantha, that is a throat or a voice, and Shira, that is a head, and weaknesses. This procedure is effectively used in the health and ailing a person for the purification of a body and the extraction of a dosha, especially a kapha in Ayurvedic system. It has been found worth to observe the physiological and the biochemical changes during a vamana and after the procedure to understand the effect and safety margins of the procedure in the healthy volunteers. Introduction. Vamana and Virechana are mainly used for the extraction of a whited dosha from the body. If the Vamana procedure is adapted properly, lightness of the body, clarity of the precordium, that is a Rudaya, throat, that is a Kanta, head, Shira, happiness, and the weaknesses are the usually symptoms of following the Vamana Shuddha, that is a proper purification. It is also mentioned that a person undergoing a Vamana never develops a Kasa, Malavradhi in a Strotas, that is accumulation of a waste in the body channel, Swarabhetar, that is a hoarseness of the voice, Nidra, that is a sleepiness, Tandra, that is a drowsiness, Mukha Durgandha, bad smell in the mouth, Vishandya, Vishajanya Upadrava, that is a complication of the poisoning, Kaphastrava, excessive salivation or a toxemia, Grahani, malabsorption syndrome. According to Ashtang Hrudaya, Samyaka Shodhana result into a clarity of a buddhi, that is a thought, strength of a indriya, sense organ, stability of a dhatu, that is a body tissue, improvement of the agni, appetite and the digestive capacity, delay of the aging. Considering these benefits, it is attempted to understand the physiological changes in apparently healthy volunteers during and after Vamana in terms of a change in the blood pressure, BP, pulse, body temperature, respiration rate, appetite, bowel habit, heaviness of abdomen, sleep pattern, and the intestinal flora, and the changes in a biochemistry and the immunological status of the body. These study also evaluate the safety aspect of the procedure. What are the materials and the methods? The present studies are carried out at Ayurveda Central Research Institute, Delhi, in a collaboration with the Department of the Physiology, All India Institute of Medical Science, that is AIMS, on 30 apparently healthy volunteers between the age group of 80 to 60 years. Exclusive criteria: patient of hypertension, diabetes, renal diseases, peptic ulcer, jaundice, acute infection, dehydration, and any other chronic diseases which are not suitable for the Vamana Karma as detected by the clinical history or the investigation. Age group lesser than 18 and above 60 years, patient with a lactose intolerance, and the pregnant and lactic women are exclusively criteria for this study. What procedure adopted for this study? Volunteers' written consent in Hindi was taken, and the information about the study was provided in the information sheet on the day of the registration. Physical examination along with the physiological parameters were assessed before and during after the Vamana. Routine blood examination like a total leukocyte count, differential leukocyte count, hemoglobin, blood sugar, kidney function test, liver function test were done so as to exclude any underlying diseases in the volunteer. The procedure of a Vamana is as per the standard protocol prescribed in the classes and adopted in the earlier Vakas. Observation. What are the observation in the volunteers which we have done the Vamana Karma? Changes in a BP. A rise in a systolic BP has been observed in the volunteers during the procedure of a Vamana. However, after the complication of the procedure, systolic BP become a normal. The systolic BP during a Vamana range from 100 to 170 mm of Hg. A rise in a diastolic BP has been observed during the procedure of a Vamana. However, after the complication of the procedure, diastolic BP became a normal, and the diastolic BP during a Vamana range from a 70 to 100 mm of Hg. The rise in a systolic BP was a more marked as compared to the rise in a diastolic BP during a Vamana procedure. These are shown in the figures and tables. Vamana effect on the pulse rate. Changes in a pulse rate. It has been observed that pulse rate increased during a Vamana procedure and was normal after the procedure. The pulse rate ranges from 65 to 106 per minute during a Vamana procedure. These shown in the figures and a table. If you have to see then go to the internet and see the article. Then Vamana effect on the body temperature also. What are the changes in a body temperature? A mild rise in a temperature was noticed during a Vamana procedure and was a normal after the procedure. The temperature ranged from the 98 to 99 Fahrenheit during the procedure. Then respiratory rate. A mild rise in a respiratory rate was noticed during a Vamana procedure and was normal after the procedure. A respiration ranged from 16 to 26 per minute in the procedure. Then effect of a Vamana on appetite. There was an improvement in the appetite volunteer after the Vamana. Before Vamana, only 40% volunteers show the good appetite. After Vamana, 73.3 of the volunteers show a good appetite. The volunteer with a poor and the irregular appetite reported improvement in their appetite. The improvement in the appetite was significant. Effect of a Vamana on a bowel habit. There was a marked improvement in the bowel habit of the volunteers after the Vamana. Only 50% were having a regular bowel habit with the normal consistency before a Vamana, but after Vamana 76.7% show a regular bowel habit with a normal consistency. Voluntary with a heart loose consistency stool and the regular timing of a bowel evacuation show improvement in their symptom. There was a significant improvement in the bowel habit. Effect of a Vamana on the heaviness in the abdomen after a food. There was a significant reduction in the complaint of the heaviness of the abdomen after a Vamana. Before a Vamana, 53.3% of the volunteer complained of a heaviness of the abdomen after the food, but after Vamana, only 20% of the volunteer were having the complaint and the rest of the 80% volunteer had no symptom of any heaviness of the abdomen. Effect of a Vamana on a sleep pattern. There was a mild improvement in the duration of the sleep in the volunteer after the Vamana. However, the gross sleep pattern among most volunteers remained unchanged. Effect of a Vamana on the intestinal flora. Pus cell count of the intestinal flora before a Vamana and 15 days after the Vamana. The pus cell in the stool of the healthy volunteers before a Vamana were within a normal range. There was no change after 15 days of a Vamana. Bacteroids count of the intestinal flora before a Vamana and 15 days after a Vamana. In the two volunteers, the bacteroids were present in a stool before a Vamana, which were absent after the 15 days of a Vamana. The changes were statistically insignificant. E. coli count of the intestinal flora before a Vamana and 15 days after Vamana. The concentration of E. coli before a Vamana ranged from 0 to 10 to the power 11 in the healthy volunteers. After a Vamana, a mild shift in the count was noticed as the E. coli count decreases, though it remained within a normal limit. The changes were statistically insignificant. What are the effects of a Vamana on the hematological parameter? Hematology before the Vamana and after 5 minutes of a Vamana, ESR decreased significantly after the 5 minutes of a Vamana. TLC, that is a total leukocyte count, increased significantly after the 5 minutes of the Vamana. Hematology before the Vamana and after 15 days of a Vamana. The hematological parameters were again assessed after the 15 days of a Vamana and the values were compared with the parameters assessed before a Vamana. A significant decrease was observed in the ESR after 15 days of a Vamana. Effect of a Vamana on a lipid profile. Changes in a lipid profile before a Vamana and after 5 minutes of a Vamana. Lipid profile was assessed at the day of a registration, that is before Snehan and Svedana. The values were compared with the result of a lipid profile obtained after 5 minutes of a Vamana. Significant increase in a high density lipoproteins, that is HDL, and decrease in the LDL was observed. observed. Total cholesterol was noticed after 5 minutes of Vamana, though there is a decrease was significantly insignificant. Lipid profile before Vamana and after 15 days of a Vamana, lipid profile was assessed at the day of registration. The values were compared with the result of a lipid profile obtained after the 15 days of a Vamana. It was observed that HDL very low density lipoprotein, that is a VLDL, and serum triglyceride insignificantly increase. Statistically insignificant decrease in the LDL and total cholesterol was noticed after the 15 days of a Vamana. Effect of a Vamana on the electrolytes. Serum electrolytes before a Vamana and after the 5 minutes of a Vamana, there was a statistically insignificant fall in a serum sodium and a serum potassium level after the 5 minutes of a Vamana. All the values of a serum electrolyte before and after Vamana were within the normal range. As a Upadrava, only one volunteer developed a Brahma, and there was a fall in a serum electrolyte level just after the Vamana, and he was managed with the ORS, that is oral rehydration solution. Serum electrolyte before Vamana and after 15 days of a Vamana, serum sodium and potassium level were assessed at the day of registration, and after the 15 days of a Vamana, the values were compared, and it was observed that there was a statistically insignificant fall in the serum sodium and the serum potassium level. All the values of a serum electrolytes before and after the Vamana were within the normal range. Effect of a Vamana on a liver function test, that is a LFT, and the functional test RFT. Effect of a Vamana on a liver function test, that is a LFT, and the renal function test, that is RFT. Liver function test LFT and the renal function test RFT before a Vamana and after 5 minutes of a Vamana. LFT and RFT were assessed before Vamana and after 5 minutes of a Vamana. It was observed that BUL, that is a blood urea levels, decreased significantly, and the total serum protein and a serum creatinine decreased insignificantly. Serum glutamic oxaloacetic transaminase, that is SGOT, and the SGPT were found to be increased significantly, though all the values were within the normal range. Serum bilirubin increased significantly. LFT and RFT before a Vamana and after 15 days of a Vamana. LFT and RFT were assessed before Vamana and after 15 days of a Vamana. It was observed that BUL, total serum protein, serum creatinine decreased significantly. SGPT, serum bilirubin were found to be increased insignificantly. SGOT were found to be increased significantly, though all the values of the above parameters were within the normal range. Effect of a Vamana on the immunological status. Immunological status before a Vamana and after 5 minutes of a Vamana. Biochemical investigation were performed before Vamana and after 5 minutes of a Vamana. It was observed that plasma histamine and the plasma adrenaline decreased significantly. Plasma dopamine and the plasma non-adrenaline increased after 5 minutes of a Vamana insignificantly. Immunological status before the Vamana and after 15 days of a Vamana. Biochemical investigation were performed. Plasma histamine and the plasma adrenaline decreased. Plasma dopamine and the plasma non-adrenaline increased. Effect of a Vamana on the immunoglobulin E. There is an increase in the immunoglobulin E after the 5 minutes of a Vamana. Discussion. Panchakarma procedure are also recommended in a healthy individual in Ayurvedic classics. It is important to understand the physiological, biochemical and the immunological changes in the healthy volunteer. The present study was carried out on a 30 apparently healthy volunteers between the age group of 18 and 60 years to observe the changes during and after Vamana procedure. Volunteers with a lactose intolerance were excluded as the milk was used in this study. Pregnant and lactating mother were also excluded from the study because of the physiological variation and the specifies do's and don'ts for them. The physiological parameters were assessed before, during and after the Vamana. The rise in a systolic and diastolic BP, pulse rate, temperature and respiration rate were noticed during a Vamana procedure, which may be attributed to the sympathetic system involvement caused by the physiological stress. There was an improvement in the appetite agni of the volunteer after the Vamana. Volunteer with a poor or irregular appetite showed the improvement. Volunteer with a hard, loose consistency of the stool and irregular timing of the bowel evacuation show a improvement in the symptom. Maximum volunteers develop a regular bowel habit with the normal consistency of a stool after the Vamana. Improvement in the heaviness of the abdomen after the Vamana was also observed. This may be due to a shodhan of a kapha and a pitta and the improvement of the Agni. As the obstruction caused by the kapha and pitta were reduced, vata in the pakvasha also regularized, resulting in the regularized bowel habit. There was an improvement in a duration of a sleep in the volunteers after the Vamana. The intestinal flora was studied before a Vamana and 15 days after the Vamana. The pus cell and the E. coli were within the normal range before Vamana and after the 15 days of Vamana. In the few volunteers, bacteroidals were present before Vamana and were absent after the 15 days of the Vamana. These indicate that Vamana is a cleansing procedure which does not disturb the intestinal flora as such. ESR decreased significantly after the 5 minutes as well after the 15 minutes of the Vamana. TLC increased significant after the 5 minutes of a Vamana. There was a fall in a plasma electrolyte BUL and the serum creatinine level, but all the values are within the physiological limit. Significant fall in the plasma adrenaline, plasma histamine, and insignificant increase in plasma dopamine and the plasma non-adrenal was observed in the volunteers after the Vamana. Conclusion: it can be concluded that Vamana is a safe panchakarma procedure if undertaken methodologically. It is a cleansing process that improves the appetite, regulate bowel habit, and improve the sleep pattern. It decreases LDL and the serum cholesterol level, and as a part its kapha action. Mild elevation in a BP, pulse, temperature, respiration during a Vamana procedure may be attributed to the sympathetic stimulation. Thus, its use in a hypertensive subject may be avoided. It improves appetite and regularize bowel habit. It also gives some relief to the feeling of a heaviness of abdomen after taking a food. It shows a mild cleansing action on the intestinal flora. However, the bacteroides and the E. coli remain within the normal limits after the Vamana. This article is published on 2012 July September. These are the info about the articles, which colleges and which professors, which doctors are involved in the preparation of this study. This one you have to see this article on the internet. Thank you so much for listening me these articles.